Good evening and welcome. My name is Gatel Ruiz Nicholas, and I will be your host for the GRN show. Today, we're talking about something very serious. In doing the research, I was really surprised to see the crisis we're faced with children mental health. According to the Centers for Disease Control and Prevention, 1 in 5 Americans will experience a mental illness each year. And it is a common health condition in the United States. In fact, a pediatric mental health crisis is the top patient safety concern in 2023. According to a report from Emergency Care Research Institute, more children between the ages of 3 and 17 are experiencing anxiety, depression, and other mental health conditions. So I really would like to have a conversation today about that because this is something, it's still taboo. There's still some stigma attached to it, and people are not talking about it enough. So tonight we're going to talk about it. I have with me Yolette Williams, who is a licensed therapist and social worker, and she's worked in the public school system in New York City for a couple of decades or more. Yolette, who's also very involved with the community, she's the CEO and the president of the Haitian American Alliance, and they've conducted many events talking about mental health. So Yolette, thank you so much for joining us, and good evening.
Good evening, Gital. Thank you for having me. It's always a pleasure. And I really love the topic we're discussing this month because it is not only so important, this is the month of May, and in May, we certainly bring attention to mental health crisis that is being explained. It is a time that really we bring notice to special than the mental health. So thank you for having me.
Super. I found out that 1 out of 7 women experience mood disorders during pregnancy and after giving birth. How does that impact their children?
Well, as you know, the mental health of the mother, even during pregnancy, has a huge impact on the child, because of the relationship between mother and child. And it's even then, there are many studies that have even shown if the parent was traumatized while pregnant, there will be imprint of that trauma in the child later on in life. So definitely, that's why during pregnancy, we encourage women as much as possible to take care of themselves and their well-being, because it will definitely have a direct impact on the child in vitro.
It's interesting, very often, and of course, having had 2 children myself, during that pregnancy, I was more so concerned about my physical well-being. I ate well. I remember with one of my children, I ate nothing but salad and fruits because we felt the nutrients will pass through the child. And I never thought about, how I feel mentally and emotionally, how that would impact the child. So obviously, this is something quite important that parents, as well as those who aspire to be parents, think about. But of course, you've worked in the school system for 25 years or more. How does one detect if there is a problem with a child who's experiencing mental illness or other challenges?
Okay, I also wanted to add that after pregnancy, after the delivery, there's a period of postpartum where it's very normal. Most women, after giving birth, they do feel a period of sadness, a period of what do we do next? However, there's a percentage of women that really experience significant anxiety, and those women, if that period of concern, of sadness, of anxiety lasts a long period of time, it's very severe. That's what we call postpartum depression. And in some women, it lasts a very long time. And this postpartum period of depression really has an impact on the child, because if the mom is not taking care of herself, even after birth, the mom is sad, she's anxious, she's depressed, and that's lasting more than 2 weeks, and it's very severe. That has an impact on the child. But along the way, moving forward, it's really the pediatrician, because when the child, who does the child see? It's a pediatrician, regular visit. Oftentimes, the pediatrician may suspect some difficulties. If not, and I have seen cases where the child would come to us in kindergarten and so forth, and you start, because the child spent a lot of time in school with the teachers, you start seeing things in the child's behavior, in the child's socialization. Some kids, they sleep in the class, they don't get along, they don't take turns, they don't share. The teachers begin to see things. And, if it's perhaps one area, maybe some kids have not learned to share, they're like late bloomers. There are cases when kids are, or maybe they don't have a sibling. But if there are several areas of difficulties, the teacher would be the first person to have a conference with the parent to ask how the child is at home. Here's what we are noticing in school.
So socialization, what I'm hearing is socialization, how adaptable the child is, can be a sign that there are difficulties. Is that what I'm hearing, Yolette?
Well, yeah,
not wanting to share, for example, maybe isolating themselves.
Developmentally, you have to look at a child. It's very normal for a 2-year-old, for example. It's me, 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 me. That's normal. Give me mine. But if you like 4 years old and 5-year-old, that's a skill you would expect a child who's developmental normally to have acquired. Because by the time are you able to play with your friends? And there are children who cannot do that. That interpersonal skills, that would be acquired. And that's why you find a lot of parents arrange play group for the children very young. And that's to help the child acquire the skills.
So I'm just taking the question a little further. So obviously the parent and the teacher, they meet, say, I've observed there might be some difficulties. What are some of the most common mental health condition teachers and health professionals see in children, especially during their elementary years, their formative years?
So when you look at mental health, or even in the school, it's very wide, because you look at the child's behavior. What would you do medically and educationally and adaptability? So meaning by saying, what I mean by that is that some children have a difficult time separating from parents, because if the child has any mental illness or trauma, our children have a lot of trauma they have experienced. So you see it at the school, because the child spent a lot of time at the school, and the school is a structured environment. So because it's structured, the child cannot follow. The child may be extremely disruptive in the classroom. The child would not do work, would not collaborate. The child, in the elementary years, if you go in from like 1st grade to 5th grade, which in a child's life, you're talking about from maybe 5 years old to 10, 11, that's a time where the child is growing and learning. A lot is required of the child at that age from 5 to 10. So there are many skills. And if you look at developmentally, we look at different things, even when I say there are different way of looking. If you look at the DMS-4R, which is the diagnostic manual, you look at children which fall under mental health as well, and educational, children who have learning difficulties, children who are autistic, children who have attention deficit disorders, children who have behavioral difficulties. All of that fall because it's all under DSM-4 in terms of mental health. But then you have the other group of mental health where the child really has some kind of psychosis, some children do, which is more significant, where the child really has emotional disturbance.
Got you. And it appears to me ADHD is a big thing in school right now. And I personally, I remember a friend of mine say, "Hey, Gatel, what do you think about Ritalin?" And I think it's a medication that they had suggested she gives to her child. I said, well, before you accept, make sure you have a couple of opinion as to whether or not, this child should be on the medication. What are your thoughts on that? Let's say the school says, I believe your child may be ADHD. What would you recommend a parent to do?
First of all, parents have to be very careful about teachers in school just making diagnosis without going to a battery of assessment. Because it could be a child who has a lot of behavior problems, not necessarily ADHD, but school and professional at the school can detect some symptoms and recommend that the child go through a battery of evaluations. So I would recommend to parents, and also pediatricians are also in that business. Now, if it is a neurodevelopmental pediatrician, I would say yes, not the general pediatrician, because there's a lot more testing that is required in terms of the child should go to a neuropsychological evaluation, a medical evaluation, a psychoeducational evaluation. A multidisciplinary approach would be the best to do. And also, the child has to have these behaviors in more than one setting. You have to see it at home, you have to see it in school, you have to see it in the playground, you have to see it at grandma's. So you have to see it in more than one setting if it's consistent. Then I would recommend to parents, if your child has ADHD, you should really address to it. I know a lot of parents don't like medication, but Ritalin, I remember when I first started my career, I used to see a lot more side effects than I see today. There are many medication, good one. And once they start, the physician, it's kind of trial and error. They'll try this one, see how it works. Maybe we'll try another one. Maybe we'll increase this, we'll decrease it. So parents should really allow some time to see whether or not the medication is effective before saying, oh, it doesn't work. And in addition to the medication, now you know the child has a diagnosis. So you, the parent, there are things you need to do. You have to work with the teacher. If you can work with a behaviorist to help you address the behaviors at home. You have to watch the child's diet. And you really have to have a structure at home because these kids, they're like very impulsive, very unpredictable. So you should, to the best you can, dinner's at 6, you sleep at 7, you don't deviate from that. And that will help. If you're going out with the child prior to leaving the home, let the child know where you're going, here's what to expect, this and that. Bring things to keep your child occupied. Because what else can sustain, like you take a child to church, the child can't sit a whole hour of church. So find a church, and there are some churches like that. I know there's a church in New York that actually have Sunday school for kids, with disabilities, or maybe they're going to catechism, or they'll do other things. So that you, the parent, you also have to help the child help him or herself.
Great, thank you. We're going to take a short break and we will be right back. We are back and we are talking about the children's mental health crisis. We were talking about, how to detect if the child needs help and making sure that the child goes to a battery of tests before it is determined that the child is experiencing, whether it's ADHD or other types of mental illnesses. So, and we have with us Yolette Williams, who is an expert in that subject matter. So Yolette, an active child can easily be labeled as having some type of behavioral or other problem. And it's very common. I think you hear if a child is bored, if a child is not challenged, they will most likely act up. At what point should a parent say, I really need to make sure I address this issue, and this, like you mentioned, maybe I'll talk to the pediatrician and see what's going on?
Well, we also have, in the Haitian community, we also have the problem when some families are also in denial. They would say, oh, he's a boy, boys will always be boys. Or they'll say, Timoun desord, and where they're not really addressing the issue. But it becomes a problem when it really impacts the child in school. Because what's going to happen if you cannot sit still in class? Your memory skill, your organization skill is involved, your socialization skill, you can't make any friends. So that really becomes a problem. Then the child will begin to lag behind his peers. So at that point, it's not just the behavior, it's also the other, how the behavior is really impacting him in the classroom and in the school or even in the community.
And another common thing I hear is, often you have parents say, I really don't want my child to get into the system. Once they are diagnosed as having whatever the issue is, they will stay in the system throughout their lifetime. I don't understand that. Could you please enlighten us as to what it is that they're afraid of in terms of going through the system?
Okay, although I've worked in the system for many years, I completely understand a parent's fears. First of all, minorities, African American and Hispanic particularly, are overly represented in special education, particularly boys. So that's a fear. And historically, they would just place children in special education without going to the proper assessment. So we really have not been treated equitably for many years. And additionally, a lot of times the schools in the inner city, in the minority communities, those schools had all kinds of problems, even for the mainstream children. So children who need additional help also have more difficulties because the school had problems to begin with. So in addressing this issue, the federal government really establish strict laws, which is IDEA. And IDEA stand for Individual with Disabilities Educational Act. So IDEA is federal. It's adopted by all the states, meaning that all children who are experiencing any sort of disabilities that impact their education, there are certain guidelines that the school must strictly follow. Those shall have to have evaluation by professionals. They need to have a psychological, educational. A lot of time, children who are learning disability have the area difficulties in language and processing information. So a very multidisciplinary approach that often includes the social worker telling the parents due process rights, because it's and that is strict from the IDEA. And also you have an occupational therapist, a speech therapist, physical therapist, whatever the needs are. So with that said, they go through a series of testing and they develop a special program based on the findings, specifically for this particular child's need. They develop what they call an IEP, Individualized Educational Program. So what happened, of course, and I tell parents, you have to be vigilant. Parents have many rights. That's why in the educational, throughout the whole process, the parent right is key. It's a multidisciplinary approach. When this recommendation is being made, the parent is a key member. This cannot be done in the absence of the parent. And sometimes there are disagreement between what the school thinks is best, what the parent thinks is best. Then the parent has the opportunity to go to a due process hearing to file for it. So parents have to be very, very vigilant and disciplined and in helping their child. So parents can actually do that. They ask for an educational hearing. They have many attorneys that specialize in education law that can help parents, and parents that cannot afford attorney. They have public lawyers like
public defender's office.
Public defenders or public office. So there are a lot of organizations who do that, and parents have to be very vigilant, because I tell your parent, now you know your child may have a problem. So you got to be vigilant, because you have to, if your child had a medical problem, you would make sure you bring the child to the doctor, give the child the medicine, put the Band-Aid on. But now that you know it's a problem, and that's how the school system is a partnership between parents and school. So parents, you have to do your share, and you have to be even more vigilant about it.
So two things come to mind. One is, obviously, if this is what, let's say the child is placed into special education program to fit their needs, is it through the 12th grade, or is this how those records kept, and how does that child, or develop over the years educationally?
Okay. Thank you for asking that. Every year they should have an annual review and look at the child progress and establish goals for the child. And the school does that. Every 3 years, they need to have a triennial evaluation. The triennial evaluation is more extensive to really look at the child to see if the child needs something more, something less, or what has happened. So what I tell parents sometimes, if you have a child who has a learning disability, for example, there are times where your child can definitely come out of the program with support. It's not, and maybe your child cannot function without support. Because a child who has a true learning disability is a child who has average intelligence, but learn differently. Learn differently. We have many famous people who are deemed learning disabled.
Mm-hmm.
What happens sometimes, there are times the child is not a true learning disabled in the sense the child does not have average intelligence, the child function lower. So sometimes they classify this child anyway to help to get services. So sometimes the child may not come out of special education because the
Mm-hmm.
child always needs the support. Because
Right.
you need accommodation to take tests. You need a reader. You need a break while you're taking an exam. You need to be taught differently. But
Mm-hmm.
you could do all that, but you are on level. That's why you, as the parent, you're looking to see, is my child learning? Can the child learn at home? Can the child do this independently? Because then you could say, wait a minute, you're telling me my child is in the 5th grade, is reading as a 5th grader, but my child could not read a 2nd grade book at home.
Mm-hmm. Mm-hmm. I see. It's very complicated. You
That's what I'm
know,
saying. It's the parent. Unfortunately, it's the parent. You really have to fight for your child and work with the school.
I have to tell you, Yolette, I am so concerned about our community, particularly, the community, Haitian American, and people who come from countries and do not speak the language. I am concerned that, and even if they have 2, 3 jobs, that poor child
Yeah.
whose parents may not be able to provide the necessary support or partner with the school, what can be done?
Well, that's too common in our communities and in poor communities, unfortunately. And that's the reason sometimes our schools are not the best because the parents are not there to watch the school and demand.
Mm-hmm.
So these children, in spite of that, parents can send an email. At least, I'm in New York. In New York, you could send an email in any language. Somebody has to translate it because you put them on notice. Parents, like let's say in the Haitian community, we have a problem. Sometimes they would send notice in Creole. The parent would tell you they don't read Creole, but they don't read English either.
Mm-hmm. Right,
And they
right.
don't read French either.
Oh,
So
it's
it's complicated. So that's why we need good community-based organization that can step in up to a point because you're not in the home. And we need like to keep the school, ultimately, I'm recommending parents to be very vigilant, but ultimately it's the school responsibility.
right, right, right. Which leads to my next question, Yolette. What are some of the resources that parents can really tap into? If the school says we suspect this, and the parents does not have the financial means or even the ability to truly understand what's going on, can you please share with us some of the resources that are available to parents whose children are faced with whether it's behavioral, ADHD, or any other mental health illnesses?
Well, I must tell you, particularly after COVID, children, young people, emotionally, they have been extremely affected. It's been reported, but it's extensive. COVID has had such a huge impact on our population, and even to bring these children back to the school system to sort of, it's almost like you reintroducing them to the school. So, and not only that, our children have seen a lot. I know, for example, in New York, we had many deaths. A lot of them have lost parents, they've lost family member, they've lost someone that they've known. Those kids have to deal with death to a level that young people shouldn't. Sometimes person right in their homes. During COVID, since school was virtual, the teachers will tell you, the kids were not there. You hear the mother, the father, or maybe the grandmother, the neighbor, the fear that was in them, because when children see that they don't completely comprehend a pandemic, they all had to deal with their own mortality in a way that no one prepared them for. The school has always been a great support, and their peers. There was no school. Children were not made not to socialize, to go out and play. So that has a huge impact on children. So right now, if there's difficulty, to deal with this trauma, I think parents should really talk to the children, find ways not to expose these kids to too much of the television and negativity, because it doesn't really help the kids. Young people like that Generation Z, they're always in front of a computer or their games. They don't go out. The kids don't go out. They don't go to the malls. They don't go to the movies. They don't hang out at each other's house. They have to be taught how to socialize, how to deal with one another. So I think parents have to try to find organizations in the communities, Little League, Boy Scout. Be vigilant about where, make sure it's a Boy Scout you trust as well. And different organizations, churches, they have organization. Parents have to really help. And if it's very severe that your child really has a difficulties that you don't know where to go, since I'm thinking of a national organization that is in different states and even cities. It's NAMI, NAMI, and I think NAMI is very helpful. They're very good. They'll even make recommendations to other places where parents can go. And then your community resources, I know in the Florida, there are several, and in New York, we have a few. Ask them. They're the people on the ground who know their community that can really. I tell parents, don't be ashamed, because there's a stigma if your child is not doing well, if your child may have a problem in school or an emotional or mental health. There's nothing to be shameful about, because I really don't know one family who doesn't have a family member who had some kind of emotional difficulty.
That is so true. That is so true, Yolette.
Yes. So on it, get help. Maybe somebody can give you direction and support the parent, instead of keeping it to yourself, feeling sad, feeling overwhelmed, and not get the support you could have gotten.
And, I've seen children turn around, from being extremely active, running and doing all kinds of things. And then you see the child grow up very differently, very calm, a little more, they're able to focus more. And actually, I've seen this little boy, make a 360-degree turn. Very good, anxious to get the homework done, and wants to do well, and very helpful, willing to help others. Say, can I help you do this? Can I help you do that? So obviously, there is hope. There is hope. There is hope. It's not all gloom.
No,
and again,
go ahead, Gitel, I'm sorry. Go ahead. I'll remember what I've got to say. Finish.
No, I was just going to say, just as you said, help is out there, because we got to look at it from a positive standpoint. It's not gloomy. It's nothing to feel sad about. It's the problem we must take care of, but there is a lot of resources out there available.
Yeah, because I was going to say, sometimes children, they exhibit depression differently from adults. Children, sometimes they're hyperactive. It's because they're depressed. So if you're going to look at depression, the child who's sad is sitting in a corner, sometimes it's the behavior the person exhibits. I had an experience, a young man, he was out of control in school, out of control. At that time, I was in a position where I would review the work the school did so we could make a recommendation. and the school and everybody. But I look at this kid's grade, he used to do well. And there's one little social worker from some community organization. I think it was a little white girl. And she said to me, it's unfortunate you guys never really know the other side of this young man. And that resonated with me. So I told her mom, so what happened? It seemed there was some difficulty in his home. His dad got deported, sent back to Haiti, and all he wanted was to be with his dad. The boy was obviously depressed. And we were about to send him to the worst program in terms of behavior, because he actually had a lighter and lit up a girl's brain.
Oh, my goodness.
Significant. But he didn't really, so anyway, but the more I spoke to him, I listened to this girl more. We decided to send him to a program instead, which was a bilingual program where a lot of the kids were newcomers. There were a lot of Haitian teachers. There were a lot of male teachers in the school. There was a Creole speaking social worker and a psychologist. I said, look, I'm sending you this kid. You do whatever you want to do. He doesn't belong there because he does not need a bilingual program, but he'll help the new kid. Mm-hmm. That's all he needed. He went into the classroom, the school. It was like the closest to Haiti he could be. Oh. He never had a problem. It was something that simple.
That's simple. Wow.
I know another Jamaican kid. He was in a classroom, but something about this teacher evoked something in him. Mm. They called his mother, and the mother had mental health problem. He and the mother had a physical fight in the school. Oh. Until the father came, and the father told us all this. So we realized let's do an intervention. He was a bright kid. Let's change his classroom. That was it. Those are a few of the
wow.
So sometimes that's all it takes. It takes somebody who knows, who cares, who's willing to give the child a chance and do something else before you take the big step.
Interesting. It's what really kind of sticks to my mind, like you said, if a parent or an adult is depressed, they kind of, they isolate themselves, they don't talk. Whereas an overactive child can be depressed. So, but anyhow, this is very interesting. And this is a topic we could kind of continue with forever. But I am so glad, Yolette, that you're able to really share your expertise with us and really help us understand a little more what our children are experiencing. To think of children's mental health is one of the major crises we're faced in 2023. To me, it was really, it was an eye-opener. So you've kind of shed light for us on some of those issues. And NAMI is one of the national organizations that we can contact because they're nationwide and also in some city. What does NAMI stands for, please, Yolette?
NAMI, I believe, I think National Association of Mental Illness or something like, I think so.
Okay, that makes sense.
It's NAMI, yes.
Okay, super. Well, I can't thank you enough for joining us, especially you're traveling, you made the time for us. Thank you so much, Yolette. And I really, I'm appreciative, and those parents who are out there, I really hope they got many nuggets from your conversation. So thank you so much, Yolette.
Thank you. My pleasure.
Great. And we're going to take a short break. We'll be back. have really changed. Nowadays we're looking at children as young as 3 years old who are showing signs of anxiety and depression. This is one of the reasons why Sesame Street has a library of short videos to help parents and children deal with children's mental health crisis. Although people are becoming more aware, things have not changed much. According to Dr. Elsie Ohms, a psychiatrist on staff with Palm Beach County Children's Hospital and Delray Medical Center, he stated it definitely feels like it's getting worse. As parents, we must find ways to discuss with our children how they feel. We need for them to externalize what they're feeling, how they're feeling, why they feel a certain way. So we must find avenues where children can truly express themselves. So when needed, seek professional help. And lastly, there are tons of resources out there. Tap into what is being offered in your community. You don't have to be too proud. It's all about supporting your child's mental and emotional wellness. So I want to say thank you to all of you who were with us this evening. Thank you for joining us. And until next time, enjoy your Saturday evening. Good night.